Okay, let's talk about the mother-son cycle. The organs of the five elements send energy to each other in a clockwise direction. Just like water nourishes the growth of trees, the wood, and wood is needed to make a fire, the organs of the water element nourish that of the wood element. Now, the kidney nourishes the liver, and the urinary bladder nourishes the gallbladder. So yin nourishes yin, yang nourishes yang. There are two parallel circles, one between the yin organs and another between the yang organs. It would be better to call this father-son cycle and mother-daughter cycle. Unfortunately, in old China, as in the new, a male child was precious, but a girl would not carry the family name and was considered an it. So we refer to the parent always as the mother and the child always as the son. How do we use the mother-son cycle? Let us suppose that in a patient, lung yin was deficient, and the patient had thin and dry skin, dry nose, and throat. We should advise the patient to drink more water and humidify the rooms with houseplants and water containers on the radiators. We can also tonify the lung yin with acupuncture. So let's talk about tonification on the mother-son cycle. In the mother-son cycle, there are two reasons why the spleen does not nourish the lung. One reason is that the energy flow between the mother and son is blocked. This is remedied by reinforcing the flow, by giving the earth point of the lung, which is lung 9. Lung 9 is called the mother point of the lung, as it receives the energy from the mother organ. By doing so, we have simply unblocked the energy flow between the lung and its mother, the spleen. Every organ has a mother point. It is the point that receives energy from the mother and is the best tonification point of that organ. So when the mother point of a yin organ is used, the energy flows in from yet another yin organ. All yin organs have more yin than yang energy in themselves. And so the energy that comes in will be more yin and little yang, like 90 is to 10. But when a yang organ is tonified, the energy that comes in will be more yang and less yin, like 90-10. Okay, let's do some working exercises. How will you treat acute gallbladder colic? So excess, so we need to sedate. Sedate gallbladder yang directly using sedation point gallbladder 38. What is your treatment for tachycardia? So we need to sedate the heart yang indirectly using SI8. So we sedate indirectly over SI8 sedation. What point will you use for acute cystitis? So this is urinary bladder, so we excess. So we sedate directly with bladder 65. How would you sedate kidney yang in kidney colic? Sedate indirectly over urinary bladder with bladder 65. So we sedate using bladder 65. We sedate indirectly. Where does the energy flow to when sedation points are used? And where does the energy come from when tonification points are used? The mother point or tonification point will always work well, provided the mother organ has enough energy. But if the patient is thin or malnourished, the spleen is also weak. It is then possible that the respiratory organs and skin are dry and poorly nourished because the mother organ has less blood and yin to send to the son organ. If we find that both the mother and the son organs are deficient in yin, there is no block between them. The cause for both deficiencies is deficiency in the mother organ. So it is then possible to tonify spleen yin and change to a diet that would improve the spleen nutrition. And the increased energy from the mother would automatically flow to the son.